Good morning, it's Dr. Larson talking about COVID-19. It is the 13th of May. I had to look at the calendar because each day sometimes seems like one day is the next, but things are getting better. Today, probably this morning sometime, the governor is going to come on and talk about what kind of metrics we need to have moving forward. So if you look at what's happening in Oregon, day before yesterday, Governor Kate Brown came out with when 70% of people in Oregon have their first COVID-19 vaccine, she's going to release all of the restrictions, or almost all the restrictions that are set in place, because Governor Brown feels like that's enough. I don't know what Governor Inslee is going to say about what percentage is enough, but we do know that we need to have some way of moving forward as a society. So there'll be some good news coming out today. We are currently in a pause in regards to moving forward or backwards in regards to COVID-19. That's the governor had to make some kind of a change before Tuesday of next week when those 2-week pause came up. So I think that'll be really good news today. I think people will be really happy with that. It's really up to us as individuals to make those goals so we can be open. So our numbers in Kittitas County are really high. I'm not going to give you specific numbers. You can go on the public health website to look at those, but we are close to being worst in the state in regards to our COVID-19 numbers. And that's just really because people are out doing things, not wearing masks, being indoors for a prolonged period of time with people who are not vaccinated. So they're personal choices. So the way we get out of this is to make other personal choices, to make perhaps better choices for the community as a whole. So our numbers are high, so we're seeing a lot of patients in the hospital. We actually had, over the last week, we had a 23-year-old in the hospital, a 21-year-old in the hospital, both for multiple days. They were very sick. They were both better. They were both out of the hospital. But what we're seeing is more severe disease in younger people. We're not seeing disease in the elderly, at least not the elderly people who are vaccinated. For example, the nursing home has 93% of their residents vaccinated, and they have not had a death in the nursing home since last August. That's August of 2020. So vaccines work, they prevent death, they prevent hospitalizations. All of the hospitalizations that we've seen in Kittitas County have been in unvaccinated individuals. So if you want to avoid being in the hospital, please get vaccinated. We have lots of opportunities to be vaccinated. You can go to multiple pharmacies in town and be vaccinated. We are working on new ways to reach people. And most exciting for me is yesterday, the whole process went through and we are able to vaccinate with Pfizer young people 12 to 15 years of age. And yesterday afternoon, at the very end of the clinic day, we had a cancellation and we vaccinated our first person in that age range. That's going to allow us to move forward with school, to have it be done safely. These kids can wrestle, they can do sports, they can do things without having to worry about getting COVID-19. It's totally safe in that age range. I would expect the FDA to formally approve all of these vaccines over the summer. It's a process to get there, but I believe we will get there. The other thing that's been going around that I want to talk about a little bit is about myths about COVID-19 and about COVID-19 vaccine. The one that's circulating currently is COVID-19 causes infertility. That is not true. It was started probably innocently enough in Germany in December when a couple of epidemiologists felt like a protein on the placenta, syncytin-1, was similar to the spike protein on COVID-19. And they made an assumption that if we develop antibodies against a spike protein, it'll also develop antibodies against the placenta and will cause miscarriages. That blossomed into it's going to cause infertility, and COVID-19 vaccine is going to cause infertility, and that is not true. Those proteins are not the same. Obviously, if somebody has a placenta, they're already pregnant, so it's not causing infertility. But it's very well. I mean, and we've since then done lots of studies. We've done studies in pregnant animals. We have had 238 live births that have occurred in people that didn't know they were pregnant when they got COVID-19 vaccine, that they have not had any more miscarriages than any other group. And those vaccines are now being tested specifically in pregnant women. So we've not had any drops in our fertility rate. If you talk to anybody who works at a fertility clinic, we've actually had more pregnancies in 2020 and in 2021 than we had previously. That may be due to all of us being home instead of being at work, but either way, COVID-19 vaccine does not cause infertility. I'll try to talk each of my talks in regards to one of the COVID-19 vaccine myths. That said, most of our wounds that we have as human beings are self-inflicted. So by choosing not to be vaccinated for COVID-19, we are just prolonging this problem. That's a self-inflicted wound. It's something we have control over. So please consider getting COVID-19 vaccine. If you have any concern about COVID-19 vaccine, you know how to get a hold of me. I'm happy to answer your question. Make sure to take care and be kind. People are still having a really hard time. Take care. Bye.